I think they were afraid that I was going to start getting septic or have a systemic blood infection from my gallbladder. It was acute enough that it had to be taken care of. And if Dr. Mahan would have said, well, I can't, I'm going to have to do laparoscopic, I said, well, I'll just wait until Tuesday because I know the difference between the two different procedures. And a Da Vinci robot over laparoscopy, I could do another day of pain for that.
When people hear, oh, you're having surgery with a robot, they think that the surgeon may not even be involved in that. So I think over the years, as more and more people have had the surgery, understood what it is, that a lot of this is spread just by people in the community, saying that, I had a Da Vinci surgery.
The first question almost every patient has is, when can I go home? And when they have the option for a surgical procedure that allows them to get home faster to their families, that's most of the time what patients are going to choose.
It minimized how often I had to convert to open surgeries or do surgeries just straight out open, which is better for patients, obviously, but it's also better for me as a surgeon because they do well, they're happier, they get out of the hospital quicker.
The community sees that, and they know that these robots are an important part of what we do every single day, and that enables us to provide great care for them.
Today, it's kind of funny, I had a patient in the office who was hoping she was having robotic surgery. There seems to be a little bit of a shift even in the community with early on when I was doing robotics being a little fearful of it to where patients want it now. They come into the office, haven't even talked to me yet, and that's what they're asking for.
For me, it's really important that regardless of where anyone is in the country or regardless of the time or day, that they have access to that type of care. And I think about my friends and my family across the country. I want that for them too. It's important for me, and I know that it's really important for our surgeons.
Cathy was in bed and didn't look well the day of surgery due to the cholecystitis, and the day after, it seemed almost like she hadn't even had an illness, and she was up and moving around her room, smiling, talkative, very animated. You could tell she had a lot better energy and was feeling well. She did come see me after surgery as a post-op visit and was doing very well, and brought me a couple little gifts from her farm.
The first thing I remember is the nurse going, Cathy, take a deep breath. Take a deep breath. You're doing really well, and your surgery went well. Dr. Mahan was evidently making rounds. I hear this knock on the door, and I'm like, I'm coming, dragging my IV pole. I was moving around and felt amazing. He came in and he looked and he said, you look like you're doing pretty good. You want to go home? It's like, yeah, I'm glad you made early rounds. I was fine. It was like any day that before I got sick. I just felt amazing.